Now, let us perform a bed bath. My patient is uh, confined in bed, or you call it bed fast. So she cannot go to the bathroom for bathing. So I need to perform a bed bath while she is lying down on her bed. So first, I need to introduce myself. So hi, Mrs. Chase. I am Romelda Lucero, your nurse for today, and I will be giving you a bed bath. Is that okay with you? And then she replied, yes. Okay. So first, of course, I have already explained the procedure, and you have to assist your client to a comfortable position, of course, and check your patient's limitations of movements. If you really need to move or to lift the patient, you have to assess your client's need and check for the agency's protocol in bathing. You have to provide for patients privacy. So if the windows are open, you close the windows. If the doors are open, you close the doors. Or you might, if your patient is in the ward, you just pull the curtain to enclose your patient in her area. So you provide for privacy. Okay, ask your patient to void. Of course, you need to wear your gloves. Position your patient in a dorsal recumbent position. So dorsal recumbent position is ask your patient to flex the knees like that so that she will have force in lifting the buttocks. So this is your dorsal recumbent position with the head, with the legs flexed, the knees flexed, rather, okay. Get your bedpan. You can ask the patient to help you when lift her buttocks. So you just support the butt, okay, and then you coach the patient. Okay, mom, when I say lift at the count of 3, you will lift. Okay, 1, 2, 3, lift. Okay, and then insert your bedpan. Okay, ask your patient to void. After your patient has voided, okay, are you done, Mrs. Chase? And she answered yes. So I will remove the bedpan. So in the same manner, okay, assist your patient by sliding your hand and assisting her as she lifts her butt. At the count of 3, Mrs. Chase, you lift your butt. 1, 2, 3, lift. Okay, remove your bedpan, okay, and put it under bed to be discarded later. Okay, so after I have assisted my patient to void, so my gloves are now contaminated, so I will remove my gloves. You see, I wear a double gloves for the purpose of, after removing my dirty gloves, I can use this in bathing my patient. Gather all the equipments that you needed. So what are your equipments? Of course, you need 2 mittens. You need your bar soap and the soap dish if you are not using a liquid soap. You need your clean gloves. You need your bath towel, bath blanket, and of course, you need your fresh, clean patient's gown and your linens for changing in case your linens will be soiled. Of course, you need your bath thermometer to check for the water temperature, and you need a pail of water. Sorry, not a pail of water. You need 2 basins for bathing. One basin is for soaping your patient, and the other basin is for rinsing your patient. So I will check my temperature, and it's warm. So I can now start with bathing my patient. But before that, we need to remove the patient's gown. So first, you have to put a bath blanket So you need to put a bath blanket on top of your patient. Okay. We need to fold the blanket. Okay, we can reposition our patient to supine. Okay, bring your patient to the side near you so that it will be easier for you to bath your patient. Be sure that side rails on the other side is up for your patient's safety. So if your patient is able, you can just ask your patient to lift, and you will just assist with her in moving to your side or nearer you, so that you will not overreach when you bath your patient. Okay, so fold the top linen, cover with your bath blanket, and you can remove your patient's gown. Now, if your patient has an IV, if your patient's gown is like this, just a snap on, so you will have no difficulty in removing, because you will just remove this one and then this one, and then just simply remove your gown. Of course, if there are ties at the back of your patient, you need to remove first the ribbon. Of course, be sure not to expose your patient. So, by the way, you can also ask your patient to hold this one. Since my patient is not a live patient, so I cannot ask her to hold this edge of the bath blanket when I fold this one and when I remove the gown. No? But as I mentioned to you, you can ask your patient to hold this one like this. No? She will hold the edge of the bath blanket. So after I remove the gown, okay, put it in a hamper. Another way of removing the gown, let's say for example, your patient's gown is not a snap-on, so you remove first the free hand before removing the armhole on the hand with an IV line. Patient is not wearing a snap-on gown, and your patient's gown is the gown which is tied at the back. So after removing the ribbon at the back, after removing the knot, okay, so first you remove the gown on the free hand, or the hand without an IV line. So supposing I have removed the armhole already, so Mrs. Chase, I will remove your gown, and she said yes. Okay, so after removing the free hand, you can remove now the gown on the hand with an IV line. So support this one, okay, remove, be very careful not to remove your IV line, okay, lower the bottle and insert it towards the armhole like this, so that it will be free of your gown. So now your patient is already undressed and your gown is already removed. You can put that in the hamper, of course. Okay, you hang, and your patient is ready now for bath. After removing your patient's gown, don't forget to check your flow of your IV line, because sometimes after you manipulated the hand, the flow changes to a faster rate. So you have to regulate again the flow. Make sure when you are performing a bed bath, you are properly protected by wearing your PPEs. Now, when you perform a bath, you should have your face mask. You should wear your gloves. You can have your gown so that your uniform will be protected. And if there is a need, you can wear your goggles. So here you will see that I am not wearing my mask because I have a hard time. I need to talk, and you will not understand what I am saying if I will be wearing my mask. So when you perform a bed bath, you do it cephalocaudally. When you say cephalocaudal, you start from the head down to the foot. So we start from the face. First, you put your towel crosswise at the chest of your patient. So prior to bathing, you can also perform an oral hygiene with your patient so that after the bath, your patient is already clean, including you have done including your oral care. Now, when you clean the face, okay, you don't put a soap. So just wring your face towel. Okay, form a mitt. Okay, and clean from the inner canthus to the outer canthus, starting from the eye from the farther eye or the eye far from you. So from inner canthus to outer canthus, you need to do one stroke. So one side of your mitt and then the other side of your mitt, from inner canthus to outer canthus. Okay, and then you can wash your mittens. Okay, but if the eyes is not that dirty, then you can proceed with the face. Clean the face. Okay, but be sure not to contaminate one eye with the other eye by using different sides of your mitt. So clean the face. Okay, so you have to clean the face, the chin. Okay, and then you can clean the ears, back of ears. Okay, the ears, back of ears, and then you can clean the neck. Now, if the patient prefers soap in washing the ears and the neck, then you can put soap, but be sure to avoid the eyes. Okay, but generally, when you bath the face, it should be no soap. So after bathing the face, the eyes, the face, the ears, and the neck of your patient, you are now ready to bath the upper extremities. So you start with the farther arm. So get your towel and expose the hand to be bathed. So expose as little as possible. So expose only the area that you need to bath, and then put your towel under your patient's arm, starting from the just below the armpit. Okay, and then get your soap. Okay, put soap in your mittens. Okay, wring your face towel. It should not be so soiled that when you use it, your patient will be too soiled, then it will drip. Okay, so hold your patient's hand like this. Okay, so bath from here. Okay, so avoiding your IV insertion. So bath, this is with soap. Okay, the ankle. Okay, and then the arms, one stroke, long stroke. Okay, and then the armpit. Okay, put your patient's hand. Okay, you can also wash the palm. Okay, in between the fingers, you can rub like that. And get your mittens for rinsing. Okay, you have to wring. Okay, there should be no excess uh, water. Form a mitt. Sorry. Okay, so you really have to practice in making your mitt. So same manner. Okay, rinse. Okay, one stroke. Okay, and then the armpit, and then you can do it 2 to 3 times or until there is no more soap. Okay, you can wash the hand of your patient by bringing your basin here. Okay, and soak your patient's hand. Be sure the IV insertion will not be wet. Okay, if this is an actual patient, then you can really soak the hand and wash the hand. Pay special attention in between in the interdigital areas, because most of the times there are dead skin in that part, and that is a favorite place for the microorganisms to stay. Okay, and then be sure after you have washed the hand, be sure to dry, of course, dry your arms and the hands. Always make sure that the IV line is not trapped. Okay, you should dry in between the fingers or in the interdigital areas. Okay, after bathing the farther arm, you have to cover that farther arm. Remove your towel. And do the same in the nearer arm. Okay, so expose the arm. Okay, line your towel and do the same as what you did on the farther arm. After bathing both arms, you go to the chest. So cover your patient until the umbilical. Cover your patient with a towel. Okay, bring the bath blanket or the top sheet, fan-fold it until the umbilical area. Okay, get your mittens, apply soap. Okay, ring, form a mitt. And then bath the chest. So you can perform a circular. For the sake of bathing, I will show you, but be sure your patient is properly draped. Okay, so here. Okay, so pay special attention here under the breast, because you will see there are skin folds, especially for those a little obese patients. So you really need to lift a little, supporting the breast with your palm like this, and then clean underneath the skin folds like this. Okay, but this one, since the breast is just the size is not that big, so I can just clean under the breast. Okay, and then okay, next you need to rinse. So get your rinsing mitt. Okay, form a mitt to rinse and do the same. Okay, be sure to rinse underneath the skin folds of the breast. Okay, and you can repeat that 2 to 3 times or until there is no more soap. So now you are done with the patient's chest. You go on the abdomen. So in bathing the abdomen, you have to lower this bath blanket. So I'm going to show you. I will uncover my patient. So this one, you bring your linen until the perineal area. You can fan fold that one. Actually, okay. Okay. So until the perineal area like that. So expose as little as possible. This towel should be covering the chest. Okay? So, nandyan na siya sa perineal area. Let's free this place. Okay, naka-fan-fold. Okay, so now we will bath the abdomen. So again, soap your mittens, ring. Okay, form a mitt. And then you have to soap the abdomen. Okay, so clean the umbilical area. Make sure to inspect the umbilicus. Okay, inspect and then clean the groin. Okay, and then after that, okay, you have to rinse in the same manner. Okay, so rinse. Okay, clean the umbilical area. Okay, and then dry. So this time, this is the best time for you to change your water. Okay, so we will now go to the lower extremities. So again, start from the farther leg. So expose the leg. So after bathing your patient's body, it should be covered. Okay, remove your towel. Okay, it should be lined. Expose the leg until the groin. Okay, and then line it with a towel. Be sure to be very gentle in handling your patient. Okay, so soap again. Okay, ring. Okay, form a mitt. And then you have to flex the leg of your patient. Okay, so from the ankle to the knees. So your hand should be supporting. Okay, ankle to the knees, and then from knees to the groin. Okay, so ankle to knees, knees to groin. Okay, ankle to, what do you call this one? Popliteal area. No, this is the popliteal. At the back of your knees. Okay, so like that. Okay, up and then there, here, and then going there from ankle, knees, down, and then you have to clean the groin area. Okay, after that you have to rinse. Okay, perform a rinse. So be sure you should be quick in making your mitt. Okay, support. Okay, rinse. Okay, rinse from ankle to knees, knees to groin, ankle to knees, knees to groin. So you do like that. Okay, okay, that is the direction of your bathing the leg. After that, okay, you can get your basin. Okay, hold your patient's leg like this, support it like this, soak it in a basin and rinse. Okay, you can soap if you want. Okay, and then pay special attention on in between the toes, especially for diabetic patients, because if that will be neglected, then that will be a source of the infection of the patient. Remember, diabetic patients are prone to infections. Okay, support the leg when you lower. Okay, and now you can dry the leg. Okay, so dry the leg, dry the feet. Okay, in between the toes, you have to dry. Okay, after that, you have to cover. Okay, remove the towel and go to the other leg. Expose the leg, put your towel under, and do the same manner as you did on the other leg. So after bathing the lower extremities, you are now going to the back part of the patient. In this portion of the video, I need an assistance from a watcher because you see my patient is quite heavy, although she is not that fat, but she is heavy, so I will call for an assistance. So here the watcher is serval. So flex the leg near you. The leg farther from you should be straight, and then flex this one. You can flex the arm going to this side, but in this case, we cannot flex. She has a fracture, okay? So we will just move the hand like that so it will not be trapped under her. And then turn the patient to the side away from you. Expose the patient's back, okay? So my patient has a lot of gadgets. Okay, so maintain a proper alignment of your patient so that your patient will not fall. Okay, so expose the back and the butt of your patient. Cover this part. Okay, so as I have mentioned earlier, expose as little as possible. Okay, and then put your towel here lengthwise at the back. Okay, get your mittens, put soap. Okay, form a mitt and bath the back. Okay, okay, so here be sure to clean especially these areas, no? So from here, okay, you can clean this one. After going here, don't go back again using the same mittens, no? Because this one is more contaminated on this one, okay? This is dirty than this part. So after here, okay, you will now rinse. Don't go back on the upper part. So if the upper part is dirty, finish first the upper part before you go to the perineal area. Okay, so rinse. Okay. Okay, you can do the rinsing 2 to 3 times or as long as there is no more soap. Okay, then you need to dry. Okay, dry your patient's back. So after that, okay, you can remove your gloves and you can perform a back rub if the patient prefers. So this is how to do a back rub. You can ask your patient if she prefers a powder or a lotion. So Mrs. Chase, what do you want? Okay, so she doesn't like anything, so I'll just do a back rub. So there are three kinds of back rub. First, you have your effleurage, and then you have your pétrissage, and you have your tapotement. So this is your effleurage. You just put your palm like this at the back of your patient, okay? And then you slide your hand going up like this, okay? You are just like forming, parang you are making a butterfly wings, okay? Like that. And then maybe for several times. After that, you do a pétrissage. When you say pétrissage, that is kneading. I will demonstrate to you how to perform kneading because here I cannot do the kneading. So it's just like pinching, like that. Okay, can you see? Okay, you do like that. So that stimulates circulation of the patient. And then after doing the kneading, okay, you can do the tapotement. When you do tapotement, you put your fingers together like this, and then your fingers will be the one rubbing to each other or hitting each other. So you do like this. And that is so it should be like this. The movement is your fingers is moving towards each other like that, against each other. That is your tapotement. Okay, so after bathing your patient, you are done with everything. You need to put on the gown. So here, this is not a snap-on gown. So you first do the arm with an IV line. Okay, so put your hand on the armhole like this. Get your IV bottle. Insert it from inside of the gown, going out. Okay, hang your IV bottle, and then put your patient's hand with an IV line. Okay, so see, okay, you are done. And then do the other hand. You can now do the other hand. You can easily insert the other hand like that. Okay, so after putting on your patient's gown, be sure to properly secure it by tying the ribbon at the back. Don't forget to check the IV flow rate. You have to regulate again your IV flow rate, because remember, you manipulated the hand, so the flow rate might be changed. And especially if your patient is a cardiac patient, your patient might have overload. So be very careful with the regulation of your IVF by just always checking after you have some manipulations on your patient's arm. Okay, so now this time, without removing first your bath blanket, you can cover now again your patient with the top sheet. After you have positioned your patient properly at the middle of the bed. Okay, if there is a need, let's say for example, your linens, your bed sheets were soiled, then you need to change it to a clean or fresh one. Okay, and then after putting that, you can now remove your bath blanket under. Okay, discard it in the hamper. Then cover properly. Put the side rails up on both sides so that your patient will be free from falling. And be sure to clean all the equipments that you used. You have to do hand hygiene again. Okay, after returning all the equipments and cleaning all the equipments that were used, discarding the things to be discarded, and then you need to document what you have done. Don't forget to always document on the patient's chart. And that is how you will perform a bed bath.